Today we're addressing a significant health concern: understanding and managing chronic stress. In our fast-paced lives, chronic stress can impact our mental, emotional, and physical well-being. It's crucial to recognize its signs and effects, from insomnia to mood swings and weakened immune function. Join me as we explore effective strategies to manage and reduce chronic stress, including mindfulness techniques, lifestyle adjustments, and seeking social support. Together, we'll empower ourselves with knowledge and practical tools to cultivate resilience and improve overall quality of life. Today, we will talk about understanding and managing chronic stress. So before we get started, make sure to hit that like button. Also subscribe to my channel. Chronic stress is a prevalent condition characterized by prolonged exposure to stressful situations or circumstances that exceed an individual's coping abilities. Unlike acute stress, which is temporary and often beneficial in certain situations, chronic stress can have detrimental effects on physical, emotional, and mental well-being if left unmanaged. This comprehensive guide explores the causes, symptoms, health implications, and evidence-based strategies for understanding and effectively managing chronic stress. 1. Understanding chronic stress. Chronic stress arises from ongoing or persistent stressors that individuals perceive as threatening or overwhelming. It can stem from various sources, including work environment, high-pressure jobs, excessive workload, job insecurity, or toxic work environments; personal relationships, conflict, caregiving responsibilities, or strained relationships with family or friends; financial strain, economic hardship, debt, or financial instability; health issues, chronic illnesses, disabilities, or ongoing health concerns. 2. Impact of chronic stress on health. Chronic stress can affect virtually every system in the body and contribute to a wide range of physical, emotional, and mental health issues. Physical health effects: cardiovascular system, increased risk of hypertension, heart disease, and stroke due to elevated blood pressure and cholesterol levels; immune system, reduced immune function, leading to increased susceptibility to infections and slower wound healing; digestive system, digestive disorders such as irritable bowel syndrome, IBS, and exacerbation of gastrointestinal conditions; anxiety, persistent worry, restlessness, and feelings of apprehension; depression, persistent sadness, loss of interest in activities, and feelings of hopelessness. 3. Assessment and diagnosis of chronic stress. Recognizing chronic stress involves assessing both physical and psychological symptoms, along with identifying potential stressors and their impact on daily life. Physical symptoms: headaches, muscle tension, fatigue, gastrointestinal issues, and frequent illnesses. Emotional symptoms: anxiety, irritability, mood swings, and feelings of overwhelm or helplessness. 4. Managing chronic stress. Evidence-based strategies. Effectively managing chronic stress involves adopting holistic approaches that address physical, emotional, and behavioral aspects. These strategies can help mitigate stressors and enhance resilience. Lifestyle modifications. Regular physical activity. Engage in aerobic exercise, walking, jogging, swimming, to release endorphins, reduce stress hormones, and promote overall well-being. Healthy diet. Consume a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats to support immune function and mood regulation. Adequate sleep. Prioritize quality sleep by maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and ensuring a comfortable sleep environment. Stress reduction techniques. Practice relaxation techniques such as deep breathing, progressive muscle relaxation, yoga, meditation, or mindfulness to promote relaxation response and reduce stress levels. Time management. prioritize tasks, set realistic goals, delegate responsibilities, and establish boundaries to reduce feelings of overwhelm and improve productivity. 5. Self-care practices for stress management. Incorporate self-care practices into daily routines to nurture physical, emotional, and mental well-being. Mindful eating. Practice mindful eating by savoring meals, listening to hunger cues, and choosing nourishing foods that support overall health. Journaling. Keep a stress journal to identify stressors, track emotional responses, and explore patterns in stress-related behaviors. Creative expression. Engage in creative activities such as art, music, writing, or gardening as outlets for self-expression and stress relief. Nature therapy. Spend time outdoors in natural environments to reduce stress levels, improve mood, and promote relaxation. 6. Professional support and resources. Seek professional assistance if chronic stress symptoms persist or significantly impact daily functioning. Mental health specialist. Schedule an appointment with a psychologist, psychiatrist, or counselor for individualized therapy, cognitive behavioral interventions, or medication management. Stress management programs. Enroll in stress management programs, workshops, or seminars offered by healthcare facilities, community centers, or workplaces. 7. Long-term strategies for stress prevention. Implement long-term strategies to prevent chronic stress and promote overall resilience. Healthy boundaries. Establish boundaries in personal and professional relationships to manage stress and maintain work-life balance. Stress-reducing activities. Prioritize hobbies, leisure activities, and self-care practices that promote relaxation and enjoyment. Chronic stress is a pervasive condition that can significantly impact physical, emotional, and mental health if not effectively managed. By understanding the causes, symptoms, and health implications of chronic stress, individuals can adopt evidence-based strategies and holistic approaches to promote stress resilience and enhance overall well-being. Through lifestyle modifications, cognitive behavioral techniques, social support, relaxation practices, and professional resources, individuals can mitigate stressors, develop effective coping skills, and cultivate a balanced and fulfilling life. What do you think of our video? Let me know in the comment section below. Before you go, please hit the like button and subscribe to my channel. Thanks for watching.